this powerful and heartfelt episode of She Decides, host Staci Swiderski sits down with Kelly Gonda, founder of FRTLTbiz, a consulting firm specializing in medical information, clinical development, pharmacovigilance, and quality management, with a strong focus on women's health and infertility. From her early career in pharmaceutical sciences to becoming a trusted advisor for global companies and a founding member and speaker for Talia Health, Kelly has built a remarkable career at the intersection of science, advocacy, and empowerment. But beyond her professional accomplishments, Kelly opens up about her personal challenges, including the devastating loss of her son, a journey that reshaped her perspective on resilience, purpose, and compassion. Through grief, she found renewed strength and a deeper commitment to transforming women's health from a place of empathy and understanding. Together, Staci and Kelly explore what it means to bring heart into highly technical industries, how women are redefining the future of fertility and medicine, and why purpose-driven innovation can heal both patients and professionals alike. Because when she decides to lead with purpose, she finds strength even in the darkest moments and turns that strength into impact, healing, and hope.
You know who made it. Welcome, everybody. I am your host, Staci Swiderski, and we are really excited for today's episode. We have Kelly Gonda here. You're all the way from Denver, correct?
I'm right outside of Boulder.
Okay. So right outside. Okay. So yeah, you're in Colorado there, and we're so thrilled to have you on this episode of She Decides. This is going to be so much fun. You have so many accomplishments. So let's dive right in.
Okay.
All right.
Let's do it.
All right. So you are the founder and the CEO of Fertility Clinic Innovators.
Yes.
And also FRTLTbiz. And you also have kind of like an umbrella of like just so many accomplishments alongside of all this. Can we kind of jump right into that and just tell us more about all that you do and really how you started?
Oh my goodness. So
I know, that's what I say. Oh my goodness.
As you know, the business that I'm in is reproductive endocrinology and infertility. It is something that I always wanted to do. I was a Catholic schoolgirl in a small farm town when the first IVF baby was born. Actually, the first IVF baby in the United States was born in 1981. I wasn't in high school then, but the egg donation started to hit the media around the time, about 1987 or so.
Sure.
Yeah. When some of the first IVF clinics were opening, but not anywhere near me. I mean,
when they really started talking about it more too, really publicizing it. So
right. And so, but I was in a Catholic school, and so I kept telling everybody, this is what I'm going to do with my life. And of course, that's the Catholic Church doesn't allow IVF.
They're not really supporting that, right?
They're not
those
supporting
fertility
it.
practices, right?
Right. So the dean called my mother and my mom told me I had to be quiet about what I wanted to do. I think she was supportive, but she was just like, well,
let's get you through school.
Don't get in trouble. So, I was like the devil horns. But actually, I got a little bit I wouldn't say bullied, but I think I got a little bit, there was definitely some people who were saying things, And
like, I'm sure too, just expressing that you had a little target on you, right? Being in the Catholic school. This is like, years ago before everything exists now. So I'm sure like you were being watched pretty closely.
Yeah, exactly. And so that was a little bit uncomfortable, but I kind of just kept going. Yeah. I just knew the path. And so I went to my 15-year high school reunion, and the probably biggest critic of me when I was in high school approached me and said, I hear you work for one of the best IVF doctors in the country, maybe even the world. He was based here in Denver. And she said, I'm having trouble getting pregnant. Can you help me?
Isn't that ironic?
It was ironic. And it's like, wow. It's like, the
full circle.
I was never like a mean girl, but she had to kind of be humble. And of course, I mean, I was happy to help her, and I'm very happy to report that she has a beautiful daughter,
that was going to be my
she's
next
11.
question.
Ileana is her name. She's beautiful. And so I'm just really happy whenever I see babies that came into the world because of something that I did, whether it be direct them to care or do their insemination or help them with their IVF cycle. So I spent about 10 years in the clinic. Fertility is high burnout when you're dealing with patients.
Mm-hmm.
And I also really wanted to advance to a more scientific position. Not that I don't love clinical, because I do.
But more behind the scenes, yeah.
Yeah. And I actually was planning to go and get my doctorate in pharmacy when I graduated high school. But life changed. I had to kind of pivot, and I had a family full of nurses. And I thought, well, because I'm a nurse practitioner, family nurse practitioner. So that whole notion of an advanced practice provider was starting to take hold. And so I thought, well, okay, I can do this. I can get at least my RN so I could start making money more quickly and then go to school. And so I did get my NP, and then I practiced in the clinic. When I exited the clinic, I went to pharmaceutical world, which was really kind of where my career took off, where there was recognition of my enthusiasm and wanting to advance. But I was a young mom, very, very young mom.
That was going to be my next question for you, because I know you have children.
I got pregnant when I was 18. And so, being a young mother, I was trying to balance a whole bunch of things. And so
being a mom, school.
Yes. And while I was in my nurse practitioner, I had my second child, my daughter. And so I really kind of just I wanted it all. Like, I didn't want just to be a career person. I wanted to have a family. I wanted to have children. I wanted everything. I wanted it all, and I wanted it all at once. So,
and that's the amazing thing, though, is that, like, you knew what you wanted, even back in high school. Like, you knew that. I know you knew, and you have accomplished that. And I think right there is, and don't mean to interrupt, but I think, wow, you saying that is such a message to our listeners, the women who really do want the same. They want to have it all. And I think that's so important for, so many women to hear that you can. And maybe it won't be instant, right? But you can take those steps to make it happen. So I wanted to kind of pause there, but let's continue. This is
and I think empowering. That the one thing that I felt, even when I was when I started the pharmaceutical industry, and then I wanted to get my doctorate in pharmacy, and I started that. So I was working full time, and while doing my doctorate in pharmacy, which I would never recommend to anyone. That was really kind of manic.
That was chaotic.
It was chaotic. God, I was manic. But you know what it was? It was messy. It felt messy to me. It felt like, oh my gosh, this really hard. I mean, pharmacy school is hard.
It's tough. Yeah.
And so I could never, I was that person who wanted to put everything in a box and tie it up in a bow and put it on the shelf, and that's done.
Have a little department for each.
Yes. And so I was lost. I was just like, I don't know what to do with this. And I remember sitting with my therapist saying, it's messy. And she's like, and what's wrong with that? And so I really had to be humbled, and also realize that, I don't know. I think that life is, career was the one place where I didn't have a mess, I think.
Okay.
I think other places, there was really kind of a rocky road.
Definitely more to adapt to something that was definitely, that didn't come really natural to you and wasn't sitting well. Yeah.
Yes. And so, I have 3 children. So I had my son. I wasn't in school at that time, but he was young when I started my PharmD. I think he was like 7 or 8. So So now he's, he's growing up, but I had a really, really difficult road. 2016. So I'll back up just one second. So having my son at 18, we grew up together. I was a single mom, and what did I do? People thought I was crazy, but I knew I had to do it because I thought, I don't want to be stuck. I was so afraid of being stuck. And I think we all get stuck, and that's totally fine if you get stuck. But like, I was afraid I'd be glued somewhere. So I took him to university. I moved into an apartment. I found a daycare that was subsidized by the United Way. I found a support group for single moms, and I just left.
Oh my gosh, that is amazing.
What are you doing? And I'm like, I'm doing what I said I was going to do. I'm going.
You carved your path, yeah.
Right, and so this kiddo and I just grew up together, and he actually, I don't think kids. It was kind of like he was a big part of my story. It wasn't like he was my identity necessarily, but my story of getting out of my family of origin, which was had its challenges. Everybody has that. But I had some significant ones there. And so I felt like we really kind of broke out together, and it was him and me against the world.
Well, and yeah, I was going to say, and your world really like revolved around him, right? And taking care of him. But at the same time, like growing yourself, as a person. And
I know.
Yeah.
And trying to also like heal my own traumas, like, work on my own stuff. So, one day, in 2016, June 2nd, I'll never forget the day, he, said to me, "Mom, I think I have a hernia." So he played football in college, and, he's a big guy, and he was bench pressing weights. So I do my whole assessment. What have you been doing the last week?
That's where the medical side of you comes out, right? The practitioner side.
My kids were used to that because I always, like when he was 5 one time, he said, "Mom, my bladder's full," instead of "I have to go to the bathroom." So yeah, that was
my bladder's full.
An eye opener that I clearly was, talking to him like that. But so he, it was, so talking medical with my kids has never been a problem, or even talking about reproductive, because that's what I've always done. So we've always been a very open family.
It's very natural.
Yeah, it's natural. So he said he had a hernia. I said, "What were you doing?" He said, "Well, I decided I was going to try to bench press 400 pounds. I said, "When was the last time you did that?"
Would do
He's
it?
like, "Oh, like 4 years ago." I'm like, "Okay." I said, "Listen, here's the deal. You're getting close to the time that you're going to be off my insurance. You need to get this checked out. And because if you have, a lot of times hernias heal on their own." I said, "But if you have to have surgery, you don't want, let's just get it done now.
Let's get this whole wellness check done before the insurance is,
right.
changes."
So he finds like a walk-in clinic, because, he's a guy. He didn't really necessarily have a doctor. And he called me. Well, actually, I called him back because after hanging up with him with the hernia story, I thought, holy smokes, something might really be wrong here, more than just a hernia. Like, I went to hernia because of the clinical picture and the story and what he was doing, which makes sense, but I wasn't there to assess it.
Right.
So I called him back because my hairs were standing. What I learned is clinical intuition's interesting. You don't know exactly why you feel nervous, but the hairs were standing up on the back of my neck. And I thought, I'm going to call him back.
Something, yeah. That intuition,
Yeah. And I said to him, I got to ask. I said, "Are you doing testicular exams?" He's like, "Mom," I'm like, I have to ask, because I guess kept thinking, what if? And
at this age, what was, at this point, what was his age? Early 20s?
Yeah.
Okay.
So he was 25.
Okay.
So mid-20s. But he, So I mean, he was a little bit like, didn't really want to answer that question, but he did.
He's like, "Why are we going there? We're talking about a hernia."
I know. And he was also like, "Mom, you taught me what to do. I know what to do." And I said, "Okay, I just wanted to make sure because, but I wasn't even afraid of testicular cancer had it been that, because I thought, well, there's a pretty high cure rate with that. They have good a good treatment protocol. And
sure.
it's really mainstream, I kind of feel like. So he calls me after he goes to the little urgent care and he says, Mom, I need to get a CAT scan. And I said, for a hernia, though, that doesn't make sense. And he says, Mom, I need to get a prior approval through your insurance. And I said, no, just go to the ER. I don't care what I have to pay. Just go and get it done, because I didn't want to wait. Because at that point, I was a little bit nervous. I'm like, what do they think? And so I still really wasn't, I don't know. I guess I still kind of felt like it's probably going to be okay, because up until that point in my life, I was always either okay or I was able to make it okay.
Right,
so I kind of, I really had this Pollyanna view, like things will work out. Why won't they? If you work hard, so on and so forth. So 3 hours later, he calls me and he tells me he has a tumor. And I said, okay, so, what are the next steps? And of course, I was pretty emotional at that point. And he said, well, they want to do like a needle biopsy of it. And I said, okay, well, that's pretty, not very invasive. And so,
and at least they, thank goodness he went to the emergency room, like you said, and just to be proactive.
Just got it done. So when they did get its tissue sample with like a needle biopsy, because but the tumor was pretty large. It was 10 centimeters. So, I mean, when you think about that, that's pretty big, but he was a big guy. So, I mean, they saw kind of weird cells. They couldn't get a hold of what was going on. So he had to have an open biopsy, and that came back as sarcoma. And I don't know what and maybe some listeners might know about sarcoma, but it's a very scary, it's got a very low survival rate. And the doctors just kept saying, we're very concerned. And I said, why are they concerned? They're saying it's grade 2. So if it's grade 2, this is not metastasis. This is not like it's catastrophizing. Right. So, but what was weird about it, it was the genetic tumor type. It was called epithelioid sarcoma. And basically it's a fancy name for joints. So you usually get it like when someone gets it, they get it behind their knee or in the crook of their arm, where there's a joint, where there's a hinge.
Is this more common because of him being an athlete as well?
I asked that question. He took some pretty big hits on the football field. But here's what I will say. The fact that it was epithelioid sarcoma and it was supposed to be in joints and it was attached to his abdominal wall, it's like it was not in the place that anybody thought it would be. And then there's only 1% of the world who gets that cancer per year in the world.
Oh my goodness.
So there really wasn't a lot of literature. So me being I'm going to think my way out of this, I stay in my head, because when I can think my way out of it, I can function.
Like a calm approach to,
and I probably should not be in my head so much, because it's not helpful. Sometimes you have to go to
it's hard to not,
it's really
hard to control.
And so I'm doing all the research and I'm like, oh boy, this is, I can't find any articles. And I found 5 of them. 1 was in German, 2 were in Chinese, and 2 were in English. That was it. And so I had them translated. I was working for a company that could translate them. So they translated the articles, and the doctors were just like, we don't really have a roadmap for treating this. All we could do is do the surgery and remove the tumor and see what's going on. So that was the next step. And the day of surgery, his surgery got canceled because the tumor was pressing against his pancreas, and it was just a whole mess. So he had radiation first. That was kind of what I was trying to, and then he had surgery. And then he got a clean bill of health at the end of September. The margins were clear. His CAT scan was clear. There was no additional tumor growth. We were all, crying. We were so happy. It's like, tears of joy. So he was getting CAT scans every month. So he got one in October, and he got one in November. And when in November, his surgical wound wasn't healing. And that was when I went to the journals and I found someone had this epithelioid tumor right here. And what they kept saying was the reason why it's not healing is it's metastasized, like it's still alive.
It's still, yeah.
So I was really nervous about that. So I'd said, should you be doing chemo? Because he just did radiation and surgery.
I was going to ask, so they never did
they
chemo.
never did
it was
chemo,
just radiation
but it was hard because I don't have access to his records at this point, right? I mean, he's my child. To me, he's still a kid,
right?
But he's not a kid. So, unfortunately, the day after Thanksgiving, he woke up with a cough, even though 10 days earlier he had a clean CAT scan. Turned out that cough that they thought was pneumonia was actually metastasized.
That was the cancer.
So he had tumors all over his lungs, chest, abdomen, and he was really sick. It went fast. So he literally, the day after Thanksgiving, Black Friday, and the following week on Friday, he died.
Oh my goodness. I'm so sorry.
Yeah, thank you. It was,
oh my gosh.
It still is this thing that is just, I can't not re-see things. Like and it just comes out of nowhere. Right. So here's this, he's my buddy. He's my,
well, you grew up together, like you said, you know, this was your focus, when your early adulthood at 18, this was.
Yeah. And I think that
your life,
my experience for losing a child, I've heard a lot of people have this experience, but the first year you're just in a complete fog, and you're numb. You just don't.
It's like you're unaffected by the world. Yeah. You're just kind of.
So, I went to pharmacy school after that because I was approached by his grandmother who told me, Kelly, you need to finish this degree. He would have wanted that for you because I had gotten into pharmacy school at that point. And I thought, how can I do this? And I think it's, I don't know if you ever saw the Frozen movies, Frozen 1, Frozen 2.
Yes.
But in Frozen 2, there's a song that talks about the next right step. And I just kept thinking, get up, go to the bathroom, wash your hands. It's like one step, the next step, the next step. And so I really had to kind of, in order not to be stuck in that place. However, I also I felt maybe running away from my grief a little bit. I was able to jump into pharmacy school and I had no time to
right.
Even though I was hurting, I had to keep going.
And how old were your other children at this point?
So
this was what, 9 years ago?
Yeah, my daughter was 16.
Okay.
So she was at the hospital when we took him off life support, and she had to witness that. My other son was only 8. So we didn't bring him to the hospital. Right. I just didn't want that. And it's bad enough that his sister has really struggled a lot with everything. So I can't imagine. And trying to hold them up.
Sure. Right.
Through this process and so he died on December 2nd, and December 30th was his birthday. So it was just, we just sort of got hit with everything all at once. So
December
I still have no idea how I didn't stay stuck. Yeah, it's just,
I mean, you are literally a poster, female person who literally is like that you didn't stay stuck and you've, and like like his grandparents said, he wouldn't have wanted that, right? He wanted, I mean, wanted you to continue to thrive and, and I can't imagine I have 4 children. I've never obviously experienced what you have. And I couldn't even imagine. But how surreal too, that you think like, wow, this is happening. And like the time just continues to go, right? The days you wake up, and you probably just felt like you were just, like you said, numb. You're just going through the motions and
Yes.
grieving that. But at the same time, I'm sure you probably got to a point where like, this can't be the rest of my life either, right? You can't, but you probably, like you said, you felt a sense of guilt. Like you don't, I couldn't even imagine. I could not even imagine. So bless your heart for like, I mean, having to literally, go through that in your life. I mean, no parent should ever. It's not the way it's supposed to be, right? We're supposed to go first before the children. Yeah, it's so unnatural. And wow. But your accomplishments, though, I mean, during that time and now even after, I mean, it's definitely, so just wow. It's
Thank you.
It's amazing. It's amazing that you've done that. And
what I kind of realized is I started to kind of wake up from whatever I was, in my fog and really had to face my grief. I realized when you're not just going through the motions, you realize you don't fit. So, you can realize you don't fit where you are.
Well, I was gonna say, I think then you like really things really like your motives in life at that point become so much more clear and so much more of like, you know what? Life is really, really precious and really short.
Exactly.
Like, I'm going to make this count and I want to move forward doing exactly what fulfills me.
Exactly. So that was really where I felt like I started to feel not at home in corporate.
Mm-hmm.
Because I finally really was in touch, right? Because when you get through that experience like that, and you have to deal with the grief, you get that feeling, and I couldn't just go through the motions anymore. That was the interesting part, and it wasn't just to do with Zach, losing Zach, but it was also it had to do with just, what do I really want? How do I live authentically and genuinely? And so that's where I started. That's why I started my companies, because I thought to myself, what's really important, and I always felt that I wanted to make a difference. And making a difference could be anything from helping a new drug get to the market for patients, access to care. So access to care became near and dear to me because fertility is cash pay in this country. People don't have access to care. They live far away from clinics. And so the fertility business also, I had been in it a long time. It changed dramatically during that time. Around that 2014, a lot of the clinics were merging into giant networks, and they were backed by venture capitalists.
Yeah, absolutely. And, just a little bit of background about me, because I so resonate with what you're saying is, I've owned my, going to be 19 years in January, a surrogacy and egg donor agency, Family Source Consultants. And so I completely understand, exactly what you're sharing, how just so many of these networks are acquiring these fertility centers and these practices. And then it's just been a whole nother world, right? It's yes.
And it really got interesting. It was, a lot of nurses were getting burned out. A lot of patients
and
were
physicians
not being cared for well, and a lot of physicians. So when I founded Fertility Clinic Innovators, my mission was to help with patient retention, help the clinics serve the patients in a way that they stay.
More on like a personal side to hear them out and slow down a little bit for them to
exactly what you're saying. So and there were articles published that 60% of patients who leave the fertility clinic are leaving because it's the disarray in the clinic. And so the lifetime cost of losing a patient is around $490,000.
Yes.
So it's like, all right, so if I come in as a consultant,
pretty extreme.
Yeah, it's like that's one patient that you lost. And then you go and think about what it costs to get a new nurse, train a new nurse. You know this is a steep learning curve
and
fertility. Yeah. So I founded Fertility Clinic Innovators. It was interesting. That's when the network started bleeding money. They just were not like doing well because they didn't know IVF. They didn't know, they had no idea what our field was anything like.
Right.
And yeah. So, but a lot of people found me from Fertility Clinic Innovators for other things. So right now I am a fractional chief business officer for a company called IVF Nomads, which is it's going to be, it's really cool what we're building. It's a job board we're thinking about having a section where people, egg donors can advertise.
Nice.
And people can find their egg donors. Right now it's just for jobs in the reproductive field. It's global, all over the world, but it's not just nurses, doctors. It's, accountants that, if they need accountants in the offices, and the trend is starting to shift. And this is what we're seeing. 3 major physicians from Boston IVF, and you know that clinic. It's very big. Yep. It's now owned by Ivy RMA, which is ginormous.
Absolutely.
I can't believe how big
network. Yeah.
It's a very big network and a global network. 3 doctors, probably the three of the best doctors, left and started a company called Terra Fertility. And when I talked to Dr. Bortoletto, Pietro Bortoletto is fantastic. He said, Kelly, I got a fellowship and I didn't have any control over my schedule or my destiny or what was going on. When I went to school to be a doctor, I didn't know that this is where I'd end up in I'm an employee type situation. So now, he's like, we did this, and he's like, and I'm so proud to say that I took my kids to school. I take my kids to school in the morning. I have control over my schedule. My quality life is better. I think these VCs are going to be backing out. And I do think we're going to see a little bit more of that.
Well, I was going to share too. I was just listening to a podcast just a couple of weeks ago, and so many fertility doctors, even, from all ages, I mean, they're just burnt out. It's just so many hours that they are putting into the, in the practices. And we're talking not even just like the founders or the owners, just literally just the, the fertility doctors. And it's this, this field is just, it's huge, right? It's just
oh my gosh, it's so
growing. Huge. But it's and it's nonstop, right? It's since I've been in it now for almost 19 years, and I can't believe, it's great, the development,
it's evolved.
And this like, it's so has, definitely. And the success rates, obviously. So that's great, but definitely, like you were saying before, that they're losing so many patients, because patients are just feeling like a number, right? So I feel like they have to evolve better on the personalized care.
And I do think that this year at ASRM, which is a yearly,
will you be going
conference. There? I will be.
I'll be there too. I'll be there.
Oh my goodness.
Sunday through Wednesday. Yeah.
Oh my goodness. I'm staying for IVF Innovate. The Innovate, because that's where they're allowing people to pitch.
Okay. Oh, so
and
cool.
It's David Sable, who is a fantastic physician. Well, first an OBGYN, then an REI, and now he is retired, but he's teaching at Columbia and he teaches startups.
Okay. Yeah.
So they're really trying to encourage innovation, and innovation that really does make a difference for patients. Right. And I recently started with a startup. This is my full-time gig now, with a company called Always Lab, which is going to be looking at the patients who are in fertility deserts.
Okay.
an hour or more away, which we know 1 in 7 are. And even if they wanted to get access to care, they couldn't afford in time or money to drive. And so this is a really cool concept. This is going to be, I think, with the doctor shortage that we have in the infertility world, the APPs are coming up and trying to help. But one of the things that Always Labs, the big initiative, is that the patient can do an AI-powered questionnaire and get kind of a preliminary diagnostic prompt and a list of laboratories, laboratory tests. And we have a mobile service we contract with, that the mobile service will go out to their home.
They will go out there.
They'll do the whole, whatever needs to be done. And then we're looking to integrate into all of the IVF EHRs so that those results come straight to the clinic that the patient chooses. And it may even help with those patients who have to be monitored remotely, right?
Right. Yeah. As we know, there's so much monitoring that goes in a place for whether IVF, egg retrieval, whatever it may be. Yes.
Yeah. And they have to go back frequently, especially toward the end. So we're talking, it's about 14, 15 days of really
start to finish, right?
Medical care. Right. And so we are taking access to a different level to where the REIs have a little more control because it's coming into their EHR. They can, give directive if they're, for example, if they're being monitored at a local OBGYN in their town so that they don't have to drive.
So they don't have to drive, right?
Right. So, but all of that can be coordinated. And we would also be doing all the insurance benefits. So as you know, not for a third party, because that's not going to be covered by insurance.
Not always covered, right?
More and more, we are seeing state mandates. We're seeing some insurance. It's slow going. And, but California is going to get their state mandate in January, apparently, for state employees. So that's 9 million lives right there.
That's huge. So it's a great start.
So there's going to be the shortage is going to become apparent. And I think that being able to streamline operations, which is what Fertility Clinic Innovators is all about, right?
Yeah,
streamlining operations.
Yeah, I love that.
And we're going to be able to do that with Always Lab. And I feel like we're really going to do. I have a egg donor, like all the FDA labs.
Yeah.
So if it's someone who wants to be an egg donor, they can get if they're in a fertility desert, they can get all their labs done and their FDA labs, everything, and their questionnaire is different. So it's a little bit more tailored. We are going to be contracting with some agencies, and so they have options because they don't do fresh anymore. They don't do like fresh
transfers.
Fresh egg donors. Yeah.
I mean, you see so many frozen, you have the egg banks out there and then,
exactly.
Right.
So, and then they do have to work through an agency because and that's really important for them to know.
Yeah,
that working through an agency is important because
they need that support and somebody to help them with all the logistics and insurance and support. Yep.
And so I'm going to make sure that, so as we're building this, we're trying to build it really with all the people in mind, even the genetic counselors, right? Expanded
all the
carrier
parties that that definitely play a part.
And allow them to also say if they want to be on our website, they can write whatever, it's not going to be something that we put a zip code in and they just pick they're matched with an agency, a doctor, whoever. That's because it is important that they might travel a little further, but they don't have to travel as much. So it doesn't
as much, right? You're limiting how often they have to do it, right? And I think definitely access to fertility care is definitely, we have a shortage, right?
Yep,
For sure.
exactly.
And because you see all the, there's so many fertility centers, but they're all in, the main cities or close.
Yeah.
So
Concentrated.
yes.
Yeah.
And, infertility is everywhere. It's not just in the, the concentrated,
Yes.
areas. So yeah, definitely access to that is a game changer. And like you said, the actual fertility doctors and really not just doctors, like really just the teams. I mean,
All
to
of them.
really let them
Yeah.
breathe a little bit, like, and
Yes.
so it will be interesting to see how all these really large networks, how this kind of unravels over the next, couple of years.
It is. It's going to be interesting. I think there's going to be a lot of evolution.
Because it grew really quickly, as we know. It just like really quickly, all these networks formed and they're acquiring all these, fertility centers, large and small, and then just creating these networks. And, and then you have so many doctors that have joined these networks, that they're used to managing, say, their practice, or they're just, fertility doctors at their existing fertility center, and then they're acquired, and it's like, are they expecting everybody to, all these doctors to perform the same? Are they still allowing them their independence? And so I think it just happened so quickly that now it's like, wow, okay. And it happened so quickly that I think the patients now are feeling like a little deserted, a little bit like
they really
that's
are.
Where they're losing that. It's where that high percentage comes into play.
Exactly. Yeah. And I think that and the people that they're hiring just really don't. They're hiring very wonderful, qualified people, not qualified for IVF, but they're
for IVF, but in
they're
general,
very good, seasoned corporate people but they can't. If you don't grasp, if they haven't been fully trained in IVF, and that's the other thing. It's
that's another thing, right?
These leaders need to be upskilled because it's never going to work if they have a VC or a CEO that came from Verizon.
Came from something that was not
successful.
Yeah. They have that business acumen, but they don't the fertility piece, the healthcare piece. It's a different
beast.
It is. It's a different piece. If you don't know it and you haven't lived it, it's really hard to understand because no matter what, I mean, with all the AI that we have and all the advancements, like you still have to handle and manage your patients like a person. And you have to take that time, and you have other ways that they can maybe streamline it, great. But when those appointment days or those days where a retrieval takes place or an embryo transfer, they have to be treated like with that care, and they sense it, they know, and that's why, because so many people just drop away because they're like, this is just too much. They're not receiving the support. So then they don't continue, or maybe they bounce around from different fertility centers till they find that one that they can feel like they're receiving that support.
Yes.
But like you said, definitely these networks, they're feeling that, they're like, oh, and these doctors are just, they're, so many hours they're putting in, and it's a lot. It's a lot. Yeah.
Yeah. So I could see where fertility clinic innovators may really have a big key role
in for sure
helping these people if they do want to. Because back in the day, when I think it was IntegraMed was one of the first networks.
Oh yeah.
And people, like the doctors, loved it because all of a sudden they didn't have to worry about their books or their business or any of it. They handed everything over to.
It was like, here you go. Right.
Here you go. And they were relieved that they didn't have to do any of that. However, I think the pendulum swung.
Big time.
About the time the millennials and the Gen Z docs started coming in, and they're like, why am I not working for myself? Like, why did I just do 85 years of school?
All of the schooling and all this education.
Now I'm an employee, so they don't like that. And they want to move out, and they I can see this happening. And so I'm excited because it's going to be good for patients.
Absolutely. I mean, think about it too. These doctors are even doing their, that are working for practices, like they're doing their, even like their own social media, their own marketing, everything. So much is falling on their shoulders. Yeah.
I know. Yeah. I know. And so I really hope that, and I got a little bit sad because I know fertility is big business. It's expensive. People pay a lot, but I felt like it became so capitalistic where, it was just like, these VCs saw this as,
an
well, look, I'm going to move
opportunity.
into that field because it's got a lot of money.
There's money to be made there.
But there was I don't feel like there was a thought
Mm-hmm.
about the patient.
Right. The patient
And
care
so,
was, I think they
so
just
that,
assumed because, like they have a team of, say, doctors and nurses and, whether it's administrative support, whatever, but people that have already been in the field, they just assume, well, you know what, we'll just do this and the care will stay the same because they have this experience. But when you're spread so thin, there's only so much care that can go around. You're minimizing, that support per patient. So, yeah, I totally agree with you. We've seen it as well on the surrogacy side, especially as an agency, where, I thought about that as, when all of these networks started acquiring, the fertility practices. And I'm thinking, oh, well, and how that's going to affect our referrals, right? Because we work with so many fertility centers. And because what had happened is they started to, many of them, not all, but many of them started to build their own surrogacy practice, right? Their own, surrogacy within their networks. But then I would say after a year and a half, seeing where like the referrals didn't stop for us because they realized it's not just it's not just surrogacy, right? You can't just say, oh, we're just going to choose the surrogate and match them with a intended parent and everybody's going to be great. That's not how it works. There's such an importance of the relationship aspect and respecting everybody's, credentials amongst that match, if you will.
It's
a long
village.
journey. So I think they realized that pretty quickly. And, but again, like you said, a lot of these, corporate people coming in and saying, we're going to do this, this, and this. And it didn't all work out that way. And it just,
exactly.
They tried. They gave it a shot, but
they gave it a shot. Yeah. One of my very dear friends was part of a surrogacy agency back in the day. And so I worked with her at CCRM when I was there. That's the Colorado Center for Reproductive Medicine for anybody who doesn't know that. But it's one of the biggest networks. And so, so I was able to really, learn from her. And so with Always Lab, where I am now, I really want to craft an experience for the patient about the patient journey, because I'm a clinician and I'm there and really get them what they need as far as letting them, like having the mobile lab go out to their work, not, because now that COVID in the world has opened back up. Even people who worked from home before COVID are being asked to come to the office.
They are. Yeah. I've seen that all over.
Which is another huge piece, right? Because now, now people have even less, even if you don't live in a fertility desert, you might have trouble getting to the clinic. So
that's right.
I feel like giving that access, having advice to help match them with the appropriate people, and letting them even do their own research and guiding them there.
Yeah. And that's what I was going to share. It comes down to also, for these patients is support, but also education, educating them, where are they at, what to expect. And really, taking the time to do that where they're feeling also heard. It's so important. And I think that definitely is an area that we need to see spark back up, because over the last, I'd say, 3 to 5 years, it's just been go, 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 go. Right. And
that's true.
Getting them through the door and just getting the cycles done and getting them hopefully pregnant and then on their way. And education, they need to be educated as well. They need that time.
So we are going to have some advisors that are going to put educational content. And we also spoke with dear Alice Domar, for anybody in the fertility world. She's amazing. And I want to have the emotional support there from the beginning.
Yes.
Because I feel like it's not until they get to the clinic and they're like, what the heck is going on?
And their head's spinning.
What am I doing? Yeah. And how do I handle this logistically and emotionally? And there's so many decisions to be made and 17,000 informed consents to sign. It's so many. And then with the state of with the VCs and this, where we are now, they're so worried about losing money now. They're starting to bleed money that patients are being rushed through even more. because it's just, how do we get more and more and more patients?
It's just,
And
it's a numbers. Yeah. It's a numbers situation at that point.
and
Yeah.
as you know, I mean, it's so good to talk to you, because someone else wouldn't maybe get it if
They don't
it's just.
understand. Yeah.
So
It's
yeah,
so
so
true though.
I really love where I am now, where I've landed, because I still have fertility clinic innovators. I did found another company called Innovative Healthcare Solutions, where this is near and dear to my heart, female athletes, college and high school, and helping, because my daughter
That's
was a
amazing.
swimmer, and I watched her go through dealing with her cycles and how does she keep her energy levels up. So through Innovative Healthcare Solutions, I'm helping an organization called Athlete RX. So
You are such an entrepreneur at heart. I mean, my goodness, like,
well, I
yeah,
think it all happened because people saw fertility clinic innovators, and these, like, people came out of the woodwork, but it was different than I ever expected. I
yeah,
thought I was going to get clinics. I was going to write up my proposals. They were going to, invite me in. I have a lot of experience. I have an MBA, so I have a business acumen. I have
yeah.
clinical, but it didn't work that way because the clinics didn't have money,
They did right.
and they were, yeah. So I mean,
Those
but
resources weren't there.
but it's like, that's how my life has happened. It's like, I see an open door and I'm like, okay, I did not expect that door to open, but yeah, let's try it.
It's
Let's
let's
see what
try it,
happens.
and then really being open minded. Like sometimes you may have
Yes.
this whole
And looking
blueprint of how it's going
around.
to be, and that's not always the
Yeah.
case.
No, that was exactly right.
Uh-huh.
That was another mess. It was messy. I thought I was going to have this like roadmap of a consulting business, and it could not be further from the truth.
Yeah, no, you have
But
to be open to pivoting. Yeah.
you have to. And so that's messy. I didn't have my box and my bow. It was like everything's all over the place. But it's landed me in place in like I said, with my own consulting business, and then this great opportunity with Always Lab to really make a difference in patients' lives. So
Well, I can't wait to follow that. I know that's going to be successful. I mean, I see it every day, like just the need for that.
I
So
know
I
you
know,
do.
yeah. So it's, I mean, kudos to you to really, paying attention to where the needs are really, really, really required. And I think that's gonna, anything. Obviously I'm a huge advocate for fertility. But anytime I see something like that, where somebody who has, you've been in the industry, right? And somebody that's coming to, a new organization, or, starting a new company like that, that really gets it, versus somebody who's just coming from corporate and they don't have any
Right.
clue, right? They're just thinking, oh, this is a
100%.
business. This is a great business gig. We're going to go with this. But like, because it's just, it opens the doors with more compassion.
Yes,
And that is just felt throughout, and it's so needed.
it
So
is
needed.
needed.
Yeah. So, and you're good, and I feel too that like that's where the success is gonna, it's gonna thrive because of that. Because again, at the end of the day, like I said, no matter how much, we can count on AI and technology, people are
Yeah.
people, and they have to be treated like that, like such, right?
Yes,
And rather than just a number. And
I
so
agree.
yeah, I see that coming full circle, like you had mentioned earlier. And so it's definitely a large need. So I'm excited to watch you grow and do something, and that you're doing something about it. I think that's remarkable.
Thank
Yeah.
you. Yeah, I really think this is going to be my way to really make a difference in patients' lives, and that's what it's always been about for me. Even
Yeah.
as I've moved through, um, I'm a nurse first,
Yeah.
um, and I think that these patients deserve better.
Yeah. I mean, thankfully you are a nurse with such an entrepreneurial like spirit, and you
Thank
can just
you.
collect all of, your amazing credentials and just make the world a better place. So this is going to be really, I'm so glad that like we connected. I mean,
Oh, me too.
it's just
This
like,
is
who would have
so
thought
cool.
we didn't think we were going to talk about fertility. See, the whole
I
time, but
know,
like,
right? And I'm like, oh, I get to see you next week,
it's so
probably.
cool. Yeah. Like
I
I'm going to
know.
find you. Yeah. So like the way it's all resonated, it's just like meant to be. This is so cool. So cool.
I agree.
Um, but definitely, like again, for our listeners, for the podcast, it's hearing your story and seeing the hurdles that you've jumped through, and you are, coming out ahead each and every time as far as, chasing your dreams, making these happen. And I think that's what we shout at the rooftop, right? That's where we want all women to feel that like it's okay to have children and also a career. It's okay if you have to pause your career to raise your children. It's okay if you
100%.
don't and you want to do both at the same time. What I think it's just, we have to, and that's really my motivation, is to empower those women who just need that sense of, like, I'm going to stop being so hard on myself for, that sense of guilt. Like, oh my gosh, like, I don't have dinner ready every night for my family, whether they're a single mom or they have, they're married or whatever, and they have a partner and they have, children. It's okay. It's okay. Or if it's what you want to do and you have dinner every night at 5 and you want to put your, whether it's your school or your job or your new company on hold for that time to spend with your family, that's awesome too. Right.
Exactly. And I think it's just, I think my message would be just move forward. It's going to be messy.
It's going to be
messy doesn't mean anything bad. Messy just feels like you don't have this illusion that you have control, which none of us really do. So even when we are putting everything in a box and everything seems like it's falling into place, that's not true. And so just get, if it gets messy, if it gets messy where it's hurting you, of course, back off.
Right.
But sometimes it's just, it gets messy, but it actually, something beautiful comes out.
Yes, I was going to say messy a lot of times equals growth. And
it does.
And a learning opportunity. And we don't, like you said, it's never a straight line. And so when it gets a little messy, make the best decisions, seek out some maybe mentors or just research, educate yourself, but just keep going. And you may have to pivot, but that's okay.
That's okay. Yeah.
Right. Right.
Nothing wrong with that.
That's right. That's right. I'm going to jump into some questions here for you.
Yes.
That we've covered so much. I just like the amount of 21 plus years of experience in doing it's just incredible. So many people can learn from you just on a business perspective, on a fertility perspective, on just like an encouragement, perspective. You've hit obviously, motivation and just like picking up the pieces and picking yourself up and just, really loving life and doing, fulfilling it as much as possible, because you obviously have endured the worst pain anybody I think can ever endure. And the fact that you have, I'm sure every day still grieving, right? That is something that you can never get over, but still able to, you have to live your life. Right. And you want to chase those, those goals and those dreams. And like you said too, like things become much more crystal clear when you are literally at the low of all lows, and you're able to at some point at least come out of the fog and think, all right, but it makes you real. Yes. And just kind of like remove anything that's just, just like noise that really at the end of the day, just do what you want. And it's so important. But obviously I know one of my questions for you was what, obviously your challenges that you've encountered along the way and how you push through them. And that was, I like to ask so many of our guests on there, and we've obviously gone through all that. But yours is so significant that this is, it's not the norm. But what would a piece of your advice be for somebody who has hit like some major brick walls? Other than obviously keep going, but like support, like I thought it was, in earlier when we jumped on our podcast and we started, I thought that was so remarkable when you had mentioned you moved, to the college and you seeked out a single mom support group. I think that most people just, wouldn't think to do that at such a young age and they're, and go to school and leave the home or, and so as far as like giving support or suggestions to somebody now that maybe, hitting a wall, what would you advise?
I would advise to have as many conversations as they can. We have access, with LinkedIn and there's another, I don't know if you're on Alignable, that's another network. And I think that what I started doing was I joined the Healthcare Women's Business Association. which opened up, they have meetups every quarter. And it's amazing women who are some data scientists, some are like really, really cool things that they're doing. And they're so inspiring, and they know people. So they know people that they can connect you with. So I joined the Healthcare Women's Business Association. I joined Medical Writers Group, and I went to one of those conferences, and that was really great just to see, how the writers handle. I did a lot of medical writing when I was at the pharmaceutical company. So I think that really having those conversations, and it does take like sometimes cold emails, and sometimes you get no answers. Like there's a lot for every email I sent, most of them were cold. If they were cold, I would say like 1 out of 25 actually answered. And so, and that's okay. Like that's, it's
to be expected. Right.
It is. And so I think it's just, and if you say to someone, you find someone you have something in common with, maybe they went to your same school, they're in your same town that you grew up in, and you have a connection, and they're doing something that you think is cool, or you want to be part of, or even to ask about their journey, because it might give you clues, and you're not going to maybe take the same journey, but you're going to say, okay, that works for them. What could work for me?
How could I spin this? Or maybe, it could be just a little piece of theirs that like, it was like an aha moment. Like, oh gosh,
exactly.
Why did I think of that? That would be so helpful.
Yes. And there are, like I said, the healthcare, I can't see enough about the Healthcare Women's Business Association. I just feel like it's global. It's all over the world. And I think that it's really just a support and showcasing what women do in business. It's amazing.
Absolutely. And again, the whole backbone to, the podcast here is women supporting one another rather than competing with one another.
Yes.
And, when you get these strong women together, and it's just, they can move mountains, and rather than, just the competition and just the, what you see, and, you'll see it on, just, I don't know, social media out there or whatever. It's like, let's support one another, and we can do amazing, amazing things. And
agree,
especially in business, because you see so many men and this is, of course, men are great. Men are, love men is, but it's just like women are just so outnumbered in the business spectrum. And so when we can come together as women, I mean, we are just so powerful. And so I love that you brought that up too, like just, learning from, these women, especially when it's the same niche that like you said, the healthcare, and all these amazing women that have just accomplished so much. And if you can get a little piece and just listen to them and just be educated by their story, we can do big things.
Yeah. And I feel like also that includes like when I've gone to conferences like that, or even the little meetups, I have, young women who are just starting their careers, and you have to reach back and offer them a hand.
Oh, yes.
And so, they'd say, will you meet me for coffee? And it is a lot of time. It's a commitment, but I feel like that's another thing. You can really make a difference in others and helping them. And through helping them, you have more connections and potentially can find something that works for you. I mean, maybe you do that as a woman, you do that. You meet with someone and you're like, oh, I could do this as a business. I might explore that, helping people in their careers. So, I mean, I think that that's the best. I mean, we're all connected to one another. And I think that it's really important to reach back and lend a hand.
Absolutely.
Any chance you get. And I had people do that for me. I'll never forget them.
And you never forget
that. It made a huge difference. So I think that's really where it is. And it's a slow process. It's not like you're going to talk to a couple people overnight, but I think eventually you'll get to a point where you're really, feeling like, okay, I think I know a path.
Yeah, absolutely. And building those relationships. And then you start to feel, definitely more confidence within yourself and secure in your, in your craft or whatever, whatever it may be that somebody's wanting to do. And hearing other women's stories, again, I think it's just, you're just not alone, and it's just empowering for sure. And
it is.
It's so empowering.
I think so many amazing things they're doing. So one woman was working with drones and how to deliver medicine. And I'm like, that is so, I have so many questions for you. And so it's really, it's a joy. I feel like that's a
really
simple
is.
joy of just being able to have a face-to-face conversation, not text.
Yes, not a text.
Yeah.
Not, I guess, online groups are great for, research and this and that. But man, when you can find even like a local something where, you can actually connect, sit down and have, a cup of coffee or a cocktail or a dinner or whatever it may be, and just to learn about one another. And like you said, to see what, because, you get to the point, at least this is how I felt like, I'm like, oh my gosh, like this is so difficult. Or am I the only one that's like this? Is it just, get to the point, like, it's not even fun anymore. It's so challenging and but I still want to keep going because you have that sense of accomplishment. Yes. You're doing something that's really needed.
Exactly.
And then you talk to these other women. Yes, it's so helpful. And then you're like, oh, wow. I thought I was the only one busy. This lady over here is like, just like killing it over there. And so, yeah, it definitely is. And then it just, reignites you. And it's just,
it does.
Like contagious.
It's motivating. Yeah. And it does, and even if you ask someone to introduce you to someone in a field that you really want to be in, there's probably going to be, that whole 6 degree of separation.
Yeah.
We all are connected to somebody and we can always help someone.
And it's a feel good, when you know that you're helping somebody or you're making a connection. Good. Yes. You're like,
that alone
this feels
can
good.
Get you unstuck, right? I mean, just
gosh.
that helping someone. So I know it does take a lot of energy to do. But I mean, look, if I could do it with everything that I've done, I think that just reach out. Just don't sit in a room and be by like yourself. There are people out there in the world that will help you, that you can help.
Yes. And they're happy too.
And the doors can open, doors that you never knew, but then, hey, maybe take a step over here and see what this is.
Right. And this could be like, wow, this was like the game changer. And then, the resources that are available, if you just kind of just reach out, they're pretty tremendous. And again, I think doing what you want to do without the guilt. I think that's, and when you're seeing all these other women just, conquer over here, and, we all still struggle. It's never like, oh, this is easy peasy. No, never. It's never the case, but we get that high on life of that struggle that makes us be our better self all the time. And it's what keeps us going. It's like, oh, we've accomplished something. I could just bring it on. What else can I figure out? And especially when it's a passion that you're following, right?
Obviously, or a new passion that you're finding.
New passion. Absolutely. Cool. Absolutely. Mm-hmm. And it's just fulfilling, right? I think that's just tremendous. And again, with all of the resources that we have these days, even if it's online resources, to find these local places or whatever, there's always that. So I just have another question for you, and then we can wrap it up with our She Decides 10 quick, fun questions. But this question, I know we were focused really on more the business side of it, but, with your personal life, how do you, how do you like to unwind personally, like outside of work? What do you do? What do you do for fun?
My drug of choice is running.
Oh, okay.
So I'm a big runner. My favorite thing in the whole world. I'm a morning runner. Okay. And so I try to time it so I could see the sunrise. And I'm by myself. I don't take my dogs or anything like that.
And I bet your morning runs are probably beautiful where you live.
So pretty.
I mean, wow.
Just different, how the sun hits the mountains one day.
The mountains are gorgeous.
This color or pink or whatever. And so that's my big drug of choice. I definitely have a strong network of girlfriends, and I make it a point to, if someone's on my heart, I reach out and I'll say, listen, you don't have to call me back. I'm just telling you, that I'm thinking
about you.
So I think that my girlfriends are definitely my rock. I think I have 2 dogs that I adore, Australian Shepherds. So they're really smart. And
dogs make everything better.
I know. It's like my blood pressure instantly goes down when I start. We get on the couch, and whether I'm reading or I've got, we're watching a show, it's like we get all snuggled up. And so I think that I do like to cook and bake. Okay. But that's sometimes just what stops me, is just not the time constraint.
I was going to say that can get time consuming. Right. Yeah.
But I do make sure I start the day doing something for myself so that I know that even if my day goes sideways, I already had my me time.
Yeah, I love that. Yeah, prioritizing yourself. I think that is so important because we usually are like our own breadcrumbs over here, like left on the plate.
And women should not feel bad about that.
Yeah,
I mean,
no.
my one day, my son, when he was really little, my youngest son, he said, "I always wake up to a sweaty mother." Because I go in his room and I'm still a little bit sweaty or my hair's wet.
Running,
he's like, "Don't worry, Mom. We're all used to waking up to you sweaty." I'm like, "Okay, good to know that
but
I
I'm very
understand
fit.
I love it. I'm in a better mood for you because
there you go. Yes, my headspace is yes. I got out there and everything's just out now. Like, I'm ready to attack the day.
Exactly.
That is great though. Like you said, like I think we have to be much kinder to ourselves for sure. And speak a lot. Yeah. Just praise our own selves instead of beating ourselves down all the time because that can easily happen. So, okay, let's move on to the fun She Decides 10 questions. Okay. And these are just quick, get to know you type. So here we go. And I already know this one, but it's so funny. Early mornings or late nights?
Early mornings.
Yeah, I figured that with your with your schedule. A smoothie or green juice?
Smoothie.
Power suit or cozy loungewear?
Ooh,
I know. I'm 50-50 on that one. Yes, I know. Comfort's amazing, but sometimes it's nice to dress up and be like, oh, that confidence.
Yeah, I like to dress up. So I'm going to go with the suit. But you can find a lot of amazing options that are more comfortable these days. So,
You sure can. Absolutely. Bold lipstick or a bare face? That's kind of bold too, isn't it? Okay. A beach escape or a city adventure?
City.
Yes, reviving. Books or podcasts?
Oof, that's hard.
I know. A lot of people are like, can we say audiobooks?
Yeah. I have to say books.
Books. Okay. Mm-hmm. A structured plan or a spontaneous energy?
Well, I always make a structured plans, but I'm prepared to be spontaneous if I have to, because I've had no choice in some ways.
Right. So you're ready for it if it comes.
Yeah.
All right. 3 more. Do you like to lead the meeting or lead the movement?
Movement.
I already know this one. Morning run or evening run? We know that's morning. And last but not least, dream big or start small?
Dream big.
Yes, thank you.
Yes. Both feet.
I would say that too. Yes, dream big, because anything can happen when you do that. So I love it. Well, this has been so much fun, and it's been such a pleasure to get to know you, and my goodness, hear your story. That's been so touching. And I know that your story is going to motivate, so many others. And I
hope so.
I really appreciate, all that you're doing too for the fertility space. That's near and dear to my heart. And so, and I, it's just been a pleasure. So I know this is going to touch so many people.
Thank you for having me. I really appreciate it.
Of course. Yeah. Well, thank you. Thank you for joining us. It's been great.